Good afternoon, friends and neighbors, and welcome to MedTalks virtual edition. And today is, of course, the topic that we're all talking about amongst ourselves and our friends, and that is everything we need to know about the vaccine rollout here on the Sunshine Coast. My name is Joanna Piras. I am proud to be a member of the board of directors of the Sechelt Hospital Foundation, and always happy to serve as your MC for these live streams. Let us first acknowledge that we live and work on the unceded territories of the Sechelt and Squamish First Nations and all First Nations people that call this land home and have done so through the years. So we always want to hear from you. We would like to get feedback from you on our MedTalks topics so far and any other suggestions you have for topics and issues that you would like us to explore. And also let us know if you want to be added to the email newsletter list so we can keep you informed that way as well. First, a word about our sponsors. Support for today's MedTalks has come from our friends and partners at the Sunshine Coast Credit Union and from the Canadian Medical Association Foundation, which is the charitable arm of the Canadian Medical Association. We are extremely fortunate to get a nice amount of funding from them, and so we've used that fund as well as some of our own funds to do, among other things, pay for the employee wellness, the Zen Den for staff to take a break while still on the property, to install 2 COVID testing tents at the Seaside Centre in Sechelt, fund the complete renovation of the Physician's Lounge, and to ensure that vaccine gets to people who are homebound and otherwise vulnerable and difficult to get at here on the Sunshine Coast. So, as we all know now, because we heard about it last week, the provincial government has rolled out its plan, and while it's constantly being tweaked and updated, there are some things that are specific to the Sunshine Coast, and that's what we want to talk about today. And as always, we welcome your comments. Put them in the chat. We have comments and questions we've received already. So we'll try to get to your questions around 4:30-ish. We'll see how it goes. I'd like to introduce the panel. We are so fortunate always to have these physicians with us. So they do, among other things, the Physicians Task Force on COVID, which has taken a lot of time, has kept us updated over the months. At the same time, they're trying to raise their families and also look after all of you patients. So we sure appreciate the fact that you make time to do this with us. First of all, let me introduce them to you one by one. Ophthalmologist Dr. Brian Nelson moved to the Sunshine Coast to start his career in 2014. His connection to the coast began visiting his grandparents in Sechelt as a child, continued with many summer vacations, which is fairly common history for many people up here. He shares his office practice with Dr. Philip Kraukamp, providing comprehensive ophthalmology services to Sunshine Coast residents. That includes cataract surgery at Sechelt Hospital. When not dealing with your eyeballs, Dr. Nelson spends time with his family, hiking the trails in Half Moon Bay, fishing, playing in the local men's soccer league, and mountain biking. Dr. Herman Mentz is originally from South Africa, moved to BC in 2010. He completed his medical degree at the University of Pretoria in 2016, followed by a 2-year rotational internship at 2 military hospitals in Cape Town. He immigrated to Canada, obtained a certification, has been working here on the Sunshine Coast ever since. He practices as a full practice family physician, also works in the ER at Sechelt Hospital, and looks after admitted patients. He's currently the lead physician for Sechelt Hospital ER. Dr. Mentz loves the outdoors and in a normal world also enjoys traveling to remote and less visited locations. And Dr. Jennifer Baxter is also a family physician at the Gibson's Medical Clinic. She also works in the ER at Sechelt Hospital and cares for admitted patients. She's passionate about the health of her community, hence her involvement with the COVID Physicians Task Force, and she has a strong focus on public health, especially in rural settings. Okay, welcome to you all. Into the details. Jennifer, can I start with you? Can we please take a minute to celebrate everything that we've achieved so far before we get into how it's happening? Go for it.
Yes, and this is a great day to celebrate. It's a challenging day in its own way. It's officially 1 year today since the WHO declared a pandemic for COVID-19, which brings with it a lot of mixed emotions for a lot of people. There's been a lot that's a past year, but we have a lot to celebrate in this community. We've done incredibly well. We've seen low numbers the whole way through this pandemic, and we're now at a point where we're offering vaccine in our local community. We've seen over 2,200 people vaccinated so far. And really, we're just finishing out the phase 1 rollout this week. We're seeing the last of our elders in the First Nation being offered their vaccines today and tomorrow. And that will wrap up the phase 1, which included Now we've got all of our long-term care and assisted living patients have all received 2 doses of their vaccine. Healthcare providers in the most critical care and emerge kind of the most exposed settings have been offered 2 doses of their vaccine. And we've been able to start rolling that out to encompass more healthcare providers. And now, as everyone is starting to become aware, we're next for our 80 plus people that live in their own homes. And so this is really exciting that we've come as far as we have, that the vaccine is rolling out, and we have people in our community who've now had 2 doses, and we're working our way through the next phases of the vaccine rollout.
Wonderful. Maybe I know that people saw it last week, but maybe can we take a look, Taryn, at the phases so we're all speaking the same language? Let's look at the phases 1 through 4, and maybe Brian and Herman, feel free to jump in and just talk us.
Sure. So as I said, phase 1, we're just finishing phase 1. Like I say, the First Nation was the one kind of key component that needed their elders needed to be vaccinated for us to be able to complete phase 1. And we're shifting into phase 2. And that's where our homebound clients who receive home care services are being vaccinated. That's where our mobile seniors that are able to come to clinics are being vaccinated, those who are over the age of 80. And more, a bit of a broader definition for the healthcare providers that are now eligible for vaccination through clinics coming up in the next few weeks as well. So lots of movement there. And then we start looking towards phase 3, hopefully April timeframe. That's the current target.
And the
phase 3
phase is going to start next week, Monday, right, Jen? So
that's right.
Yeah, some movement as of next week on the second phase.
Exactly. Yeah. Yeah. So we've seen some of our home care clients have been getting their vaccines the last week or 2. And exactly those clinics for the community kind of home dwelling 80 plus year old seniors are now about to start next week, which is very exciting. And I have to say,
look at the principles behind the phases. I think phase 1 and 2 were really about death prevention, and where we saw the most loss of life in our province and elsewhere was long-term care homes. Mm-hmm. And then those working with people with COVID and seniors over 80. So we're moving down the chain of people in terms of risk, and it's great to see that moving along.
You're very right, Brian. It's very much about protecting our most vulnerable in our community, and how do we best do that? And we're starting to see those widening circles of who's incorporated in that. But you're very right about kind of why things were prioritized the way they were there. And I have to say, our community is really, I've been really impressed and humbled by how well our community is embracing the vaccine. I was fortunate enough to be able to do some of these immunization clinics over the last few weeks, and to be at our nation and just to see people stepping up and taking those doses has been incredibly encouraging. You know, we saw up to about 90% uptake in our Indigenous elders, and I raise my hands to them and all that they're stepping up and showing incredible leadership in our community by doing that, keeping themselves and their community safe and the rest of us safe by doing so.
And I think another big thing to celebrate is we had no major outbreaks in any of our long-term care facilities. We were really well protected. And now with vaccination, of course, we're hopefully seeing better numbers even. But
Right. It's a huge point to celebrate. I mean, 3 care homes and some other assisted living and long-term care facilities, and we didn't see an outbreak. And that's just a huge testament to how well all of our staff did, and all of, everyone did with their PPE and all of the appropriate donning and doffing and staying home when you were sick. All those principles, everyone has done such a good job following all of those. It's really kept our community safe. And now we're, after you get 2 doses, I mean, that's excellent, exceptional amount of coverage from those vaccines. So,
can we run through what the process is? Again, we're assuming that people know it was different because the 15th was the 8th was the eligibility for most of the province for the over 90s and the over 65 and First Nations, but it was different here on the coast. So can we walk through for people what they need to do if they have not yet registered? When can they do that, and how do they do that? And maybe we can look at the phone number for that too.
Yeah. years old or older in our community, you're eligible at any time now to phone the number and book an appointment for yourself. Unfortunately, VCH had some challenges the first day of the rollout that really there were issues with the call center and its capacity. Those have been resolved, and people are waiting less than a few minutes to book in for vaccines at this point. So we strongly encourage anyone who's 80 years old or older, or if you're Indigenous 65 years or older, that you're now welcome to phone in, book yourself an appointment for your first dose of your vaccine. And we very much ask that anybody who is not of those age categories to not phone that number. If you have questions about vaccine eligibility, by all means reach out either to your family doctor. You can phone the walk-in clinic and talk to a doctor. There are options there to access information, but that's not something the call center can provide, and it's really delaying those who are eligible from booking their vaccines. So
I think with the only exclusion is people who have home care services that's currently being provided. Those folks don't necessarily have to call the number because home care services will reach out to them.
That's right. And it's important to remember that you can also call on behalf of someone else. So if you've got a family member who's not able to do that themselves, by all means, we really encourage everyone to look out for each other right now and help out with that. Your family doctors are trying to identify people that might be the most vulnerable and have the most trouble making those phone calls and make sure they're having access. But there's a lot of people who don't have a family doctor, and just looking out for each other right now is one of the best things we can do to make sure everybody who's eligible gets vaccinated when it's their turn.
So when you're out for a walk in your neighborhood and you come across some of your local seniors, check to see if they have successfully registered and if they have maybe give them a hand with that.
You got it.
Perfect. So where are people getting their shots on the Sunshine Coast?
So the public clinics are being held there at the Madeira Park Legion, at the Gibsons Legion, and then the Senior Center here in Sechelt.
Okay, and what do we need to know? What do people need to know? What should they be prepared for? I've heard some people complaining that they thought the shot was really painful, and some people got a little bit sick afterwards. What can we expect both at the immunization center and afterwards?
Maybe I'll start with kind of what to expect right at the site. So you'll check in, you'll be, kind of registered into the provincial database that's keeping track of everyone and when they got which dose and of which vaccine. And then you'll kind of walk your way through and to the next place where you'll just be checked off based on your appointment time and then brought to the next available immunizer. It's a combination team of nurses and physicians, and I'm sure moving forward we may see some other community healthcare providers helping out as well. You'll receive your vaccine, you'll have a chance to ask any questions you might have, and then you're asked to wait 15 minutes afterwards in the facility. Everyone's given a space, a place to sit down and have comfortably wait 15 minutes so that if you were to feel unwell, you'd be in a place where we can address that. So although very uncommon, the most serious side effect would be a severe allergic reaction. And so we're watching out for symptoms of that. We, of course, have what we need on hand to manage it, but we're trying to make sure we have people somewhere where they can access care if they need it. If you have a history of anaphylaxis yourself, then you'd be thinking probably you're going to wait half an hour, and just to be prepared for that, just because your immune response may be that little bit more triggered kind of to respond a little bit more sensitively. And so we tend to ask that people with that history wait for the half hour.
And are any of you aware of people feeling quite ill afterwards, of having sort of flu-like symptoms and real soreness from the injection site? Or Brian, maybe have you heard that?
There's been a range. Yes, when I was given my first vaccine a couple of weeks ago, they warned me it's not uncommon to have a bit of a mild fever and feel a little unwell the next day. Because I'm a healthcare worker, if I did have that, I'd have to stay home. Luckily, I didn't. I just had a bit of a sore arm, but they will give you some information about what's possible, what's expected, and what's worrisome. And it's not common to have a major problem after the injection, other than the usual mild after a flu shot, not feeling 100% for a little while. And possibly the second dose brings a bit more of that on, but you would be warned about that ahead of time, and you should make plans if you have a critical day of work the next day. When it gets to the working age folks, then you might not have the shot the day before.
Right. Herman, can I throw you the flaming ball? And that is to talk about the differences between the vaccines. That's one of the things I've heard some people say, oh no, I'm going to wait for the Johnson & Johnson vaccine. I don't want this or that. Can you please address the vaccine question?
Absolutely. So currently we have 4 vaccines approved in Canada. At the moment, we're getting basically just Pfizer, BioNTech, and Moderna that comes up to the coast. The 4 vaccines we have is Pfizer, BioNTech, Moderna, AstraZeneca, and Johnson & Johnson. The first 2, Pfizer, BioNTech, and Moderna, is very much similar. They're what we call mRNA vaccines. So basically what they do is they have cells that make a protein that triggers an immune response without using the virus that causes COVID-19. And once it's triggered in the body, then these antibodies can then help fight the infection. So how it works with the Pfizer BioNTech is the vaccine is given obviously by injection into the muscle of the arm. For the vaccine to work best, you need 2 shots. And if you read the manufacturer insert, it says 21 days, but studies have shown 4 months is ideal actually, because you actually lodge a better response after a longer duration in between. So currently in BC, we're timing it about 4 months apart. And an immunity that develops over time. So it takes about 2 weeks to develop significant immunity against COVID-19, and that's after the second shot. And then if you look at the studies on the Pfizer BioNTech, they tested 45,000 participants, and of that, 95% effectivity of the vaccine. So it's a really good vaccine. Usually starts within 1 week after the second dose, where you can start seeing immunity, but we generally say 2 weeks is a good time frame. The common side effects, I think Brian and Jen has already alluded to, but it's typically just a bit of pain on the site of the injection. Some people can get body chills and a little bit of flu-like symptoms and a low-grade fever. And there's a very small minority of people that can develop serious allergic reactions. And so those are the people, obviously, as Jen mentioned, that we will be monitoring after the shot. The second shot, Moderna, is quite similar to the Pfizer BioNTech. Again, it's an mRNA vaccine and works exactly the same way. And the studies they've done on those 30,000 participants, it was 94.1% effective. So quite similar to the Pfizer BioNTech. And again, immunity starting about 2 weeks after the second dose. The third vaccine is AstraZeneca, which is quite different because that's a virus vector-based vaccine. So what it basically means is what you get is you get a virus. It's not the same as COVID-19. It's an adenovirus, which typically is just a common cold virus that they use. It's a harmless virus typically that they use in the vaccine, and that lodges an immune response and again creates a spike protein to the SARS-CoV-2 protein, and actually that is the way that the immune system reacts to the antibodies. And then these antibodies can fight off the infection if you do end up getting COVID-19. So quite a bit different than the Pfizer, BioNTech, and Moderna. And the studies on the AstraZeneca has shown that it's approximately 62% effective after getting the 2 shots. Again, the immunity develops about 2 weeks after the vaccine. Because you do get a virus vector vaccine, the side effects are quite similar, but sometimes people are more likely to have a bit of viral type symptoms, so you can get more chills and feeling tired and feverish with the AstraZeneca. Currently, because of a lower effectivity, although it's a really good vaccine, but 62%, it's not being offered for people over 65, just because the other 2 vaccines are still showing higher efficacy. So for people higher at risk, they're still doing the Pfizer, BioNTech, and Moderna. And as time goes on and we'll learn more about the vaccine, that may change. But currently we're using it for under 65 only. The 4th vaccine is the Johnson & Johnson vaccine. And again, it's also a virus vector-based vaccine, so quite similar to the AstraZeneca. The only difference with this vaccine is it's a single-shot vaccine. So you only need 1 dose, which is given. And in 43,000 participants, this vaccine has shown about 66% effectivity. So again, a really good vaccine with immunity developing about 2 weeks after vaccination. We haven't seen much of Johnson & Johnson in Canada, and as far as I know, the supplies are quite limited, and we probably won't see them for quite a while. So I think the anticipation is that majority of we will be getting on the Sunshine Coast will be Pfizer, BioNTech, and Moderna. And at some point, we may see some AstraZeneca come through. That's just a quick summary on all the vaccines.
And Jen, I know you have a comment that you'd like to make about that any of these vaccines is good, that we shouldn't be concerned about which one we're getting. So can you tell?
I mean, you've heard some slightly different numbers. Part of this is still evolving evidence. I mean, these have been developed and tested and brought to market within a year, and most of us never thought that would happen. That's pretty impressive feat for the scientific community. And so these are all incredibly effective, more effective than the vast majority of vaccines that we typically use for other illnesses on a more regular basis. And I don't foresee people really being able to pick and choose which vaccine they get. I think the province is very tightly regulating where they distribute what based on where it's most effective and where it's most needed. I would really discourage someone, let's say, from holding out for Johnson & Johnson, because we may not see flow of that, as Herman said, for quite some time. But we do have a lot of Pfizer and Moderna moving into the province at this time. Thus far on the coast, we're really seeing Pfizer as the predominant vaccine that's available. Honestly, if it was for myself, I would take any of them, whatever's available when I'm able to book an appointment. And I think there's more benefit to getting vaccinated sooner than holding out for a potential theoretical difference in efficacy that 2 or 3 years down the road, who knows what the numbers will really look like. I think they're all good. And we do see, actually, even at 2 weeks after your first dose of the Pfizer and Moderna, we're seeing up to 80% efficacy prevention of transmission of infection. So it's very effective even from that point. And then we get to boost that to 95% with second dose, which is, as I said, it's almost unheard of in vaccine literature to see something quite that effective. So, they've done an incredible job with these vaccines, but I think they're all equally good candidates for different reasons for different people.
I'll put this out to all of you, are there people who should not get the vaccine? And obviously they need to consult with their physician, but are there pregnancy, for example, should pregnant women get the vaccine?
Pregnant women are offered the vaccine. The Society of Obstetricians and Gynecologists of Canada has a policy statement. They've reviewed all the literature. The challenge we always have in pregnancy is that you're never going to do a double-blinded study and test whether it works or not, right? Or what the risks are. Thus far, we don't have reason to believe that there's negative effects for the baby or for mom. There's a lot of benefit to preventing someone from getting COVID in pregnancy or in the newborn period. There's a potential harm to the baby and or preterm delivery and all sorts of other risks if you do get COVID while you're pregnant. And then obviously our young newborns don't do well with infections either. So the recommendation is that you certainly, if you have any concerns, make sure you talk to your maternity care provider, whether that's your family doc or a midwife or anyone else that can answer those questions for you. But if you're pregnant or breastfeeding and are interested in the vaccine, it's most definitely available for you when your time comes up.
How long after receiving the vaccine can people breathe a sigh of relief about their own vulnerability, and how long before they can resume normal life? Herman, maybe you know the answer to this one.
So, the studies show about 2 weeks after having good immunity, and that's after the second shot. And as Jen alluded to, the first shot, you can have up to 80% immunity after the first 2 weeks too. As to the question of normal life, that's a tricky one because we don't have enough studies in post-vaccine era to see if people are still transmitting the virus. And until we have full herd immunity, I don't think that our policies are going to get a lot looser. And so I think people will need to continue with the restrictions until we know what it looks like in terms of herd immunity.
And that's very much the message we heard from the province today. There was a very excellent, another modeling presentation from Bonnie Henry. And once you're vaccinated, that doesn't change any of the regulations. You still need to follow all the public health guidelines and recommendations and regulations. We're still washing our hands all the time. We're still wearing masks. We're still keeping our social distance. We're still not gathering in homes. We're now, as of today, able to gather outdoors up to 10 people, as long as it's the same 10 people that you spend time with outdoors every time you come together. But none of those other regulations have gone anywhere yet. We're just not at a point where we can take that risk. And we have the slight wild card of these variants, and still learning to what extent our vaccines that we have available right now are going to be effective against the different variants that we're seeing creeping up. We're fortunate we're not seeing it surging like it is in Ontario right now, but it's still prevalent in our province, and the numbers are increasing with those variants, and they just spread that much more easily. And so that's where we have to double down on those keeping your distance, wearing a mask kind of efforts to make sure that we're minimizing the transmission of those more lethal and more easily spreadable variants in our communities.
Okay. Brian, we keep talking about herd immunity. What does that actually mean?
That means that there's enough protected people in the community that the virus snuffs itself out and can't be passed along fast enough to grow in numbers. So Dr. Henry is going to be watching our daily case counts, and that's probably going to drive the policy changes in terms of what we're allowed to do. So we're hoping, if we get down below 100 cases a day, she might make a change, something like that. But as long as the virus is still running through the communities, even at a moderate pace, it still warrants our public health measures. So the sooner we all get our vaccines and keep our distance until that time, the sooner we all get to go back to normal.
Is it likely then that by the time we finish phase 4, sometime towards the end of the summer or the fall, that we will have then achieved herd immunity just by virtue of vaccination volume?
Ideally, yes. If everybody that's offered a vaccine, if 70 or 80% of those people get the vaccine and the vaccine works as well as we think it does, then yes, we would be there, and we sure hope that's the case. And we're seeing pretty good uptake of the vaccine, so let's be hopeful.
Certainly here on the Sunshine Coast, we haven't seen a great deal of vaccine hesitancy. I don't think, what I've heard from all of you. What would you say to people that are leery, that are reluctant?
I get asked a lot from personal friends and family about this country had a problem with one vaccine. And what I tell people is that there's millions of these shots being given every day, and every government that's delivering these shots has a extremely fine-tooth comb going over all the safety data for this. So they're picking up very small signals of potential problems very early and publishing them and playing it safe. And everybody in the world's talking to each other about their experience with the vaccine. So it's more studied already than most medications are, I would say, in terms of the volume of people that have had it and the amount of safety data being collected. So I would reassure people that you will know if there's a problem with these vaccines. Yeah,
I agree. And I think it's a very strong reputation for being cautious when it comes to bringing new drugs onto the market. Health Canada has, as Brian says, a very rigorous process for approving medications, and none of that was compromised in approving these vaccines as quickly as they were approved. Really what happened was all the manpower went to one task. And so they just put the resources they needed into approving these as quickly as they could, but they still did the due diligence and reviewed the evidence just as thoroughly and made sure they got all the final details. That's part of why we had some delays. For instance, we approved AstraZeneca a little bit later than some other countries. And that was just Health Canada said, we want a little bit more information, went back to, getting that little bit extra information before they said, yes, this is safe for use in our country. So I have a lot of faith in that. And I trust that, the best interest in the health of of Canadians was really taken to heart when these decisions are made.
Taryn, can we take a look at the registration slide one more time, just while we're talking about this, for anybody who doesn't yet know where to phone or what the process is? Can we maybe take a quick look at that, the slide with the yellow border and the number, the 1877 number?
Mm-hmm.
I can't tell if it's up or not.
It is.
Okay, wonderful. So maybe let's talk a little bit, let's walk people through that process if they have not yet registered or they're not yet eligible.
So if you are currently eligible, then by all means, you're welcome to phone that number or phone that number on behalf of someone who is eligible. If you do not have a means of getting yourself to to a vaccination center, do let them know when you book the appointment. We are working on how we can best make sure that everybody who's eligible for vaccine and wants one gets one in our community. So there are strategies kind of in the final stages of being planned to make sure that we reach out to everybody. if you are able to get to a vaccine clinic, then that's exactly what they're for. And we're, staffing them to meet the demand that's available. Kind of keep up with the supply that comes into our community. Moving forward, we're anticipating online registration will be open in future cohorts. So as we move into phase 3 and 4, it's likely that we'll be transitioning to a much more virtual option for signing up for your vaccine, less reliance on a phone number. But the thought was, I believe at least, that having access to a phone number is easiest for a lot of seniors, and so that would make sure that we didn't leave people behind. And that's very much the message I try to remind people of is no one's going to be left behind. Even if it's not your turn yet, you will get your turn as long as you're over 16 and don't have a contraindication to the vaccine. It will be offered, and when it's your turn, we will make sure you get it. It's just a matter of being patient as we deal with what are incredibly difficult ethical decisions that have been made at the highest levels to determine how do we most effectively protect our most vulnerable with a limited resource. So,
and as I understand it from the military commander who's leading the, we'd have 36.4 million doses by Canada Day. So it sounds like the supply is no longer the challenge that it once was. Is that correct?
It's much less of an issue. We're anticipating, very hopeful, that the supply will keep flowing as it is right now, which is night and day from a month ago when we had very tenuous supply. So it's very encouraging. And then it's a matter of how do we logistically administer that? How do we have the manpower, the people power to be able to administer that many doses in a short period of time? And that's where we just ask everyone to appreciate there are some limitations in how quickly we can do that. I mean, we're getting it out as fast as we can, in making it as available as we can. And we just, in a smaller community, we have some different limitations than maybe an urban setting has.
Okay.
But we're by all means doing our best.
Alrighty. Taryn, maybe can we take a look at the slide that shows the pieces of identification? We would hate for people to show up for their appointment and not have brought the proper ID. So maybe let's take a quick look at what you can bring, what you should bring. Obviously your personal health or care card, if you still have that one in your wallet, as identification that proves your age and your identity. Anything else? Anything else to?
That's what you're bringing with you. And then you'll walk out with 2 pieces of paper. One is the record of the immunization that we ask that if you can, you bring it back for your second dose. You're also registered into a provincial database, so the information isn't lost. And then we're also offering wallet cards for everyone, which we're anticipating if we get to a point of needing to be able to prove immunization status for things like travel in the future, that has the dates of both of your doses and which vaccine you got. And so that would be something you could hold on to and provide should you need to prove vaccination.
Okay. Am I correct in assuming that for the second shot, you will be contacted about your second shot, or was that just something that was floated, but that's not happening?
I wouldn't count on it. I would say, I think the process of notifying people who are eligible for second doses is still being developed. But I think it's helpful if people can also be as aware of what's going on in the media as possible. And when we get to a point where it's time enough from those first doses, it will be made very public who's able to register again for second doses. And just to make sure those in your life that might not otherwise hear about that information, if you can support them, then help them through that process again.
Alrighty. I would now like to dial Jane McDonald in. And Jane, as most of you I'm sure know, is the Executive Director of the Sechelt Hospital. With all the questions that are coming in via the chat and also that are being submitted via email. So Jane, why don't you have at it with questions that are coming in?
All right. Hi, everyone from the Hospital Foundation office here at Sechelt Hospital. Thank you all for the great questions that came in before today's session and those that are streaming in literally in live time here on the chat. So I'm going to combine about 6 very specific questions and just ask the doctors here of, is there any consideration for those with either medical and respiratory conditions, undergoing chemo or cancer, with heart conditions or serious respiratory conditions, is there any opportunity for a younger group to be vaccinated for COVID-19 sooner? So could you talk about the exceptions and what's the role of the GP and patient consulting relationship here?
It's a very good question.
6 questions, sorry.
There is a list of extremely clinically vulnerable conditions that are listed as part of phase 3. So when individuals who are 70 and over are eligible for their vaccines, there will be opportunities for those who are younger than that but have one of these conditions to be vaccinated. So I won't provide the exhaustive list, but by all means, people who are receiving active chemotherapy, people with severe respiratory issues, that sort of thing are all included in that. And you can certainly access the BC government website and it has that list available. So you should be able to identify whether you will qualify or not. The exact process for how that will roll out is still being developed. So I can't tell you exactly how you're going to register, but I can tell you that you will be eligible to register at that time and that more information will be coming about what exactly that will look like. I would always encourage people, if they have questions or concerns, to chat with their family doctor if you have one. If you don't, by all means, reach out. There's the walk-in clinic available. And if you're followed by a specialist, talk to your specialist about it, because they will also be dialed in onto how their patients who are at highest risk are able to access the vaccine when it's available for them.
Great. Here on the Sunshine Coast, we have, we know a number of property owners that have multiple residences. And there's a question here regarding owning property here on the coast, living here part-time, also an Ontario resident, and hold an Ontario health card. I do not wish to travel to Ontario for vaccine after sheltering in place here on the coast. Would it be possible to obtain my vaccination here along with a subsequent booster to minimize the risk? Any thoughts here for folks that are visiting the coast or have been sheltering here in place?
I think, Herman, do you want to go ahead?
No, I think we were going to say the same thing. I think for people who've been residing here and who've been following public health guidelines, sticking on the coast, I don't think there's an eligibility issue for those folks. I think it's discouraging people for traveling up to the Sunshine Coast for vaccination from the mainland or from other areas would definitely be something we would advocate. But I think somebody like that who's residing here longer term, I don't think that there's any restrictions on those people getting their vaccine locally.
Okay, how will we location here on the coast and how many can be done in a day?
Ooh. Well, they did an excellent job organizing on the nation, I must say. I believe last week they got through 180 in one day. So we do have options to vaccinate a lot of people in a day. There's a big team that's showing up to help with all this. I believe, as far as I'm aware, when you book your appointment, you book on a day, and that also comes with a location. So you can choose where to access your vaccine, assuming there are times available on the day in the location that you're interested in. So it should be possible for people that reside in Madeira Park to be vaccinated there and not have to travel to, let's say, Gibson's. That shouldn't be happening. It should be possible to choose your location. And yeah, I think that kind of 180 number is probably close to the top end of what we can get through in a day, but it also depends how long each clinic is. Some of them are more like 4 hours and some are 6 hours. So it just depends on the day.
Is that 180 per clinic or total?
Yeah, that was in a one-day clinic.
Awesome.
Mm-hmm.
A question about the time frame. What we've just shown on the screen shows the various phases, and that people at 59 and under getting vaccinated between July and September. Bonnie Henry's just said that everyone's now going to be vaccinated by July 1st. Why the discrepancy? And is there an updated timeline or a recommended most reliable place for information?
By all means, the BC government website is the most reliable place for the most up-to-date information. I think these phases are, and Bonnie Henry was very clear when she rolled these out, that these were based on the anticipated supply at the time that she wrote them. So now that we have higher input of vaccine available, we are looking to be able to escalate those timelines. I don't think anyone's yet at a point where they can predict exactly when or how much earlier someone in their 50s might be able to get vaccinated, except to say that it's looking pretty encouraging that it'll be before July. So I think it's, stay tuned to the government website, stay tuned to Bonnie Henry's announcements, because she will by all means be updating her information as soon as she can. Where there's a lot of logistics that goes into distributing the vaccines. And, we're seeing, for instance, right now, AstraZeneca's going primarily up to Prince Rupert, up to the north, where they have some big outbreaks, and they can vaccinate a younger age demographic with the vaccines. So there's a lot of factors at play that make it hard to give exact predictions of timelines. But those provincial resources are really where we're going to have the most reliable information.
A few questions regarding sort of the efficacy of only having one vaccine, the first phase of the vaccine. So questioning when immunity takes place, and then when is it safe for interaction with others? And are those who are vaccinated still required at all times to follow the sanitizing, mask wearing, and social distancing protocols? And ultimately, when can we start hugging again?
That is the $1 million question, isn't it?
I think we kind of addressed that a little earlier, but I think we know it takes about 2 weeks for immunity, and as Jen also said, after the first shot, you got about 80% coverage. So it's better than nothing, but it's much better after the second. As for going back to hugging, I don't think that's going to happen anytime soon, just because we don't know what happens post-vaccine. So we'll just have to kind of see how it plays out.
And remember, the 2-dose vaccines, we're going to be giving the second doses out in 4 months of the 80-year-olds getting their shots now. So that might be a time period to think, because more people will be getting their second doses at that point. So the herd immunity will be closer, but we have at least a 4-month lag where nobody will have their second shot.
Mm-hmm.
And that's where we hope the provincial numbers just drop dramatically with the people that have their first shot, enough that we can relax restrictions. But until that happens, we will have to just watch and wait.
And there's really that two-pronged benefit to the delaying that second dose. I know there were a lot of questions around that, around why are we waiting and is it safe to do that? And I think Herman alluded to the fact that it's actually potentially more efficacious for the vaccines if we delay to that 4-month window. The body needs that time in between the doses to really mount that second most effective immune response. And it also allows us to get this vaccine out to as many people in the first round as we can. And if you think about 80% efficacy for far more people, we have a far better chance of really getting the numbers down and really keeping our community safer. So
there have been a few questions about, you can say that, various variants, and any presence here on the Sunshine Coast. And maybe you could say a bit more about the respiratory assessment clinic, the testing center we have in Sechelt.
And the shot we have that Sharon will flip up.
That's right. Yeah, sure. So when it comes to variants in the province, I mean, Bonnie Henry today showed ultimately thousands of variants, minuscule differences in genetic material, but the most concerning variants that we're seeing are the one from the UK, the South African variant, and then we've had one small cluster of the Brazilian variant. We aren't given detail to know whether it's been present on the Sunshine Coast or not. We just aren't given that level of detail. I can certainly say that right now on the coast, we're not seeing that level of outbreak or spread that I would typically associate with those variants. But, that may also just be that people are doing all the right things. As soon as they start to feel unwell, they're isolating until they get tested. And once they're tested, they're isolating until they get a result. So those key features still remain in place. And even after you're vaccinated, any respiratory symptoms whatsoever are not caused by the vaccine. So even within days of your vaccine, you still need breathing trouble, cough, shortness of breath, nasal congestion, upset stomach. None of that's coming from the vaccine. You know, your flu-like symptoms, your muscle aches and fatigue and fevers, that could be. But we still, 80% is fantastic, but it's not 100%. So it is still possible to get COVID even after you've been vaccinated. We've seen case reports of that in the media. It's still important, if you get any symptoms even after you're vaccinated, that you treat it just as seriously as we always have, that you get tested at the respiratory assessment clinic, and that you isolate until you have a negative result and you're starting to feel better. So the respiratory assessment clinic will stay open for as long as we need it. We have a really great team right now. We have all along, to be honest, but it's a great team that's working there. And those, it looks a little like circus tents, but they are absolutely incredible. I love driving by them every day. Just the people are, for the vast majority, being tested in their vehicles. If you need a further assessment, a more detailed physical exam, we might ask you to come into the clinic, but the vast majority of people are tested in their vehicles, which I think makes a lot of people feel safer. As before, both the nasal swab and the saline gargle are available for testing. As long as you haven't had anything to eat or drink or smoke or gum or gargled or anything in your mouth for the last hour before you come in for your test, then the saline gargle is an option for everybody at this point, not just children.
Great. And then a few questions just about the logistics of calling. Can I call at any time? What if I miss my age and time frame? Do you move on once you've done the 85-year-olds? Are we no longer allowed to call anymore? How does that work? And if someone is in their 70th year, for instance, are they able to book for over 70, or is it necessary to be the actual age when they're booking the appointment? There's about 10 questions along that theme.
So booking appointment is by year of birth, very strictly. And so when you call in or when you register online, you will have to have the appropriate year of birth, and that's being published by the province every time the eligibility opens up. When it comes to whether you're, if you happen to miss it now, you're always eligible moving forward. So you would still be able to book in for a clinic, if you're with the 50-year-olds, if you're 80 and didn't get it. So, we obviously encourage people to get it now, but if there's a reason that's not possible, then by all means, you'll remain eligible. You won't miss your chance. I think that's the message I keep trying to remind people of, is no one's left behind with this. It might take a little bit of time to get through to everybody, but no one's going to miss their opportunity for vaccination. So by all means, if you were once eligible and now want it, you're able to reach out.
Final words, Dr. Nelson, Dr. Menz, final thoughts for our community?
Keep up the good work. Keep up the good work. Everyone do their distance and their hand washing, and I think we'll get there in the next couple of months, hopefully. We'll just give it time, but I think everyone's doing great, and I think our community is definitely lifted up, and I think we've done really well through the pandemic. So I hope people can just push through a little bit longer.
Yes, thanks everybody for your efforts and keeping us one of the better places to be in the province this past year.
Yeah, it's been incredible. And I'll just echo Bonnie Henry's comments from today that this has been a tough year for a lot of people. And so this is the time to reach out. And we talk about our seniors a lot, but it's also important that we reflect on the youth and how much their lives have changed from, their school experience, their life experience, being able to play with your friends, all those things that are so critical to growing up, and how much they've given up to keep everybody else safe. And so just make sure you're checking in with them as well, and just really look out for each other through the next few months as we, as Herman said, hang in there that little bit longer. Keep up with all the hard work we've been doing, and we're going to see, we've already seen the benefits of that in our community. And so just sticking with it that little bit longer will make a big difference.
So we're sending out these hugs.
Exactly. It's virtual hugs.
A virtual hug out to everybody. Well, thank you, all of you, Dr. Nelson, Dr. Mance, Dr. Baxter. Thank you so much for making time, for doing everything else that you do and not just this. I also would like to thank our sponsors and partners again, Sunshine Coast Credit Union, the Canadian Medical Association Foundation, all of you for being here, for sending in your questions, for constantly keeping in touch with us. There is a survey on this SHF, the Seashell Hospital Foundation.org website. There's a survey asking you, what would you like to see? What would you like us to talk about? And Jane, correct me if I'm wrong, but I believe that we are planning an update on the vaccine rollout in early April, because by then we will know more. And again, the goalposts probably will have changed. Is that correct? Yes, Jane's giving me thumbs up, so that is correct. Thank you very much for joining us. It's always a pleasure to have these community conversations. Stay well, stay safe, stay connected. Let us know what you'd like to talk about next. Thanks very much.